Carpal tunnel syndrome, symptoms, diagnosis, and treatment from Parkway Neuroscience and Spine Institute. Part 2 of 3.
I'm Betty Jo Zonis, physical therapist, and I work at Parkway Neuroscience and Spine Institute. So I'm going to talk to you about some conservative things you can do. A couple of you raised your hands and said you did have surgery, but I'm assuming the rest of you are here because maybe you're having some symptoms, you're not sure, you haven't been diagnosed, and you're not sure what to do. So some things that are usually recommended that you do first, and most doctors will tell you this if they give you the diagnosis, is to try some splinting. So there are many different splints out there. I brought an example of one we keep in the clinic to show patients, but basically you're looking for a splint that has a support to keep your wrist in neutral, okay? Because remember, Dr. DeMarco talked about the carpal tunnel, and if you saw that one nerve ran through it, but then at least 9 flexor tendons run through it that help you make a fist. So there's not much space in there. So at night when most people sleep, they'll sleep in the fetal position and they do this, and that compresses the carpal tunnel. So a lot of times people will get symptoms they'll notice first at night. So they'll recommend splinting at night, and that's to keep your wrist more neutral. Works better for the mild or mild to moderate severity. If it's pretty severe, sometimes they'll recommend that you wear the splint full time for maybe 3 to 4 weeks to see if you can get it calmed down, okay, before you maybe try something else. And then you also want to avoid activities that might worsen your symptoms. I'm going to go over some changes maybe you can make at work. I've been found all different activities can cause or make your carpal tunnel worse. So examples I show though is changes at your computer station, because a lot of times people who do repetitive work like that will notice it, although people who do a lot of sewing or stitching, crosswork stuff, you can also notice carpal tunnel symptoms. Dr. DeMarco talked about symptoms or other conditions that contribute to carpal tunnel. Some things we can't control, like genetics, although some things are very controllable, like you can get better control of your diabetes, you can stop smoking, and you can just start a good exercise program, because we have to keep our muscles warmed up to get the blood flowing and circulation in that area too. There's also other things you can try, like stretching, strengthening, different exercises. If you need help with those things, you may want to consider a trial of physical therapy before you do a surgical intervention. And I do things to help with inflammation, teach you different postural exercises, how to stretch, how to strengthen, how to do different nerve and tendon glides. Okay, so those are just some things. So we talked about ways to minimize stress on your wrists and hands. You want to relax your grip strength if you're, writing a lot, and you're holding your pen or pencil really tight, or you're doing a lot of carpentry work. Try to reduce your grip strength. Take frequent breaks. Watch your form. And I looked around. Everybody has pretty good posture in these chairs. But we will talk about some ergonomic changes you can make and just ways to sit with good posture, because that will help. And you do want to keep your hands warm, because we have to keep things moving. Okay, so if you had, or if you were going to go sit at your computer for a long time, or you have a desk job where you are typing a lot, there are different exercises you can do. This is just an example of some warm-up exercises. Just gets the nerve moving, gets the tendons gliding, and then you would do about 5 repetitions, or hold 5 seconds, do about 10 repetitions. And then you want to take breaks and just do it throughout the day. Just get up and keep your hands moving. Okay. All right, so this is where we want to spend a little bit of time. And everybody's probably seen this picture, but let's just talk about the importance of good posture while you're sitting. So you're here because you want to learn about carpal tunnel syndrome, but I'm also going to tell you I give this same picture to my patients who come in with low back pain and have a desk job, with neck pain, or even with shoulder pain, because your posture plays such a role in everything. Okay, so if you can see this person, and this is in the ideal world, and you're going to hope that your employer works with you and allows you to make some of these changes, but you do want to keep, let's see, you do want a nice lumbar support. Keep your shoulders in a nice neutral position at your side, because if not, if you're working up here, that makes this muscle work, then people come with neck pain, puts a stretch on the nerve, and just isn't good overall. You do want, let's see, keep your elbow at 90, and again, we want to keep our wrists at neutral. Okay, sometimes you'll have to wear the splint while you work, and you want to keep like 90-90 at the hips and the knees. Keep your monitor at eye level, and I'm going to talk to you about some changes or different input devices you can use to help make these changes. Again, most times, employers will work with you to make these changes. If you're just looking to make changes at your home workstation, you can find tons of things out there as far as chairs and desks and pull-out keyboard trays. If you do have a job where you're sitting all day and you're doing this typing work, you might want to consider using different input devices like different mice, or using a pull-out tray and things like that. And then you might have to change them throughout the day. It's whatever works for you. This is just an example of an armrest you can use, because again, it helps her keep her elbow at 90, her shoulder at neutral, and her wrist in a nice neutral position. And then that could easily be removed, but, and see, her monitor is at eye level. So you might need an armrest. And again, you may want to try one of these things. You may have to try a lot of these things. There are tons of keyboards out there. This one has a mouse in the middle of it, so you're not constantly reaching out, because that's going to put a stretch on your nerve. So you want to make sure you keep your mouse as close to your body as you can. You don't want to be reaching out like this. That's going to put everything in a stretch position. These are just examples of different mice, I guess, that you can use. This one was actually pretty neat. This one's one you control with your feet, so you don't have to use your hands. This one is vertical, so you're more neutral like this, and you're not in maybe an extended position, which is going to decrease the space here in the tunnel. And this is a trackball. So there are tons of devices out there that you may want to consider using. This, I think, is very important, is you want a pull-out keyboard tray. I'll get lots of people who come in and they're working all day and they're typing, but they don't have this pull-out tray. So again, their arms are up like this, their shoulders are elevated, they're constantly reaching to the side for their mouse, and that, again, just makes symptoms worse. So, okay. So Dr. O'Malley is going to talk about surgery, but I'm just going to tell you real quick about things you can do after surgery. Physical therapy is always an option. So things that we can do after surgery. We can even do these things before surgery, because I mentioned we do things to help control inflammation. These are examples of some modalities, they're called. They're to control pain and inflammation. This is an electrical stimulation machine. Helps control pain, can be used to control inflammation. Your typical ice pack. This is an ultrasound machine. Now, Dr. DeMarco talked about an ultrasound as a diagnostic tool. We use ultrasound as a treatment tool. So this is set on a different frequency. I don't get pictures with this machine. It actually helps reduce inflammation by delivering a deep heat. It delivers sound waves in there. So those are things we can do, some of the things we can do. There are exercises, and we talked, well, you saw on the picture that the nerve runs through there and all the tendons that run through there. So you have, after surgery, and you can even try some of these things before surgery, there are some nerve and tendon gliding exercises you can do. There are some fisting exercises you can do to get all of these are called your flexors, okay, to get your tendons moving within that tunnel, okay. You'll want to do some strengthening and stretching and some postural exercises. There are a lot of manual techniques that can be done to help reduce pain. One of the ones that a lot of people find beneficial is something called myofascial release. Fascia is a real thin connective tissue that covers muscles and blood supply and nerves in your body, so in internal organs, covers everything, real thin connective tissue. And sometimes you can get adhesions or kind of tightness in this tissue. Especially post-surgery, you might be getting some scar tissue forming. So we will want to do things to help release that and control those adhesions. Think of your nerve like a piece of dental floss in a straw. That's how it would glide, but sometimes it gets stuck within that straw and then it doesn't glide, and that can cause pain. We can also work on mobilizing joints at the wrist or shoulder or neck, wherever problems may be. So those are just some of the things that can be done to help control symptoms on a more conservative route. But now Dr. O'Malley is going to talk about surgery, because you've tried all these things and now they don't work, so what's the next step?